Okay, here we go. Just a quick little this is to get you through EMS charts. www.emscharts.com. It is password protected, and it is case sensitive, as some of you have figured out. So you log in. If there is a warning that it's a trusted site, please allow it. Hit yes. Or if ActiveX needs to install, let that install. When you come here, you're going to see this is basically the home page. It will tell you if you have incomplete charts, if you have charts that are flagged for QA. Okay, it'll be right there. So if I've given you comments on one of your charts, that will be here. Here it is for the Center for Rural Education. But this is kind of what we're looking at. So one of the things is when you had first signed on, you had to click on security settings, and then you actually had to put a new password in. A 9-digit number. It doesn't have to be your social security number, but then how to reset your password. I really prefer that I'm not resetting everybody's password. So anytime you want to get back, you just hit home. Okay, and that's going to take you to the page. So to start a chart, let's see this. You come over here to the left and you click on patient records. Alright. Then to your right over here, there's a button that says create blank chart. You're going to click that. And this is all done by pop-up, so you need your pop-up blocker off. And this is the first thing that you come with. Your patient record ID, new record, is the first three initials of the patient's last name and the current date. So 0406/2009, base site, EMS service, unit, EMS unit, category, back pain, because you guys are killing me. And again, crew, referring, or where you're going to is whatever. Put in your call types, your hospital. You can edit your times here as well. So you add a patient, click that. Most of them it's going to be add new patient. Again, you're going to put demographics in here. For this, I'm just going to click unknown, hit save the patient. And then you come up with past medical history. You have current medications and allergies. So anytime that you go back and forth, you want to use these buttons down at the bottom of the page here, either next or back. You do not want to use the back buttons on the Internet Explorer or Safari. So then you have your chief complaint. Again, it should be what the patient states. You can mark duration if they have any secondary complaints. Your history of present illness. That is basically where you're going to do your sample, your cheated, your OPQRST. That's where you're going to put that in. There are boxes down on the bottom left, down here, that if you're doing a cardiac arrest, we need to see that. Scene description to the right, other EMS, patient belongings, or anything that any factors that had to do with that may have been delaying the care. So again, and patient belongings is not a bad thing to put that you deliver transfer sheets or patient's belongings. Again, this breaks it out more into systems. You have neuro. Everything here is blank. So again, You can use the drop downs, but most of this is going to be that you have to put text in. Now, if you covered this in your sample or your OPQRST, all right, I'll catch it in the narrative here. But a couple of you, like under airway, had an unresponsive patient. There was no mention for sample OPQRST or anything, and you left airway blank. That is not acceptable. So again, we're going to hit next page, come up with some more systems for respiratory, cardiovascular. Remember that the pertinent positives, if a patient has chest pain, is very important to document, but your pertinent negatives, if you have somebody who's in respiratory distress, there's pertinent negatives as well as cardiovascular, that they don't have any chest pain, they don't have any diaphoresis, no nausea or vomiting, there's no radiation, things like that. So, and then the next page is more of a secondary survey. Head, chest, abdomen, neck, pelvis, back, extremities. If you didn't assess them, just write NA. You didn't assess them. In some circumstances, you may not even be doing anything like this. But again, this is here. Next page is going to be your vital signs. And any of the treatments, medications, procedures that you do, this is where you document them. You always have to put a time in here, otherwise it won't count. The protocol that you're working with, I don't really care about. Who assessed the patient, though, is pretty particular. So again, you can do, you should be documenting any changes in your assessment or the patient's condition, even if you applied oxygen, you gave nitro, you gave aspirin, even splinting here. Neuros before and after, backboarding and splinting should be done here. And then again, your last thing, being that that there were no changes en route are appropriate to document. And then you're basically done. If you have any 12 leads or anything, you can attach them here. The Social Security number that they're looking for, because of HIPAA requirement to electronically sign a chart, you need to put your Social Security number in. But that's basically it. With this, I do want to come back and show you that if you hit the home key here, and you go back to any of your patient records, okay, just that, let's see here. If I have a comment for you, what I'm going to do is I'm going to type something in here, okay? And maybe something more I want to see or a question I want to ask. You may get notified, depending on how you set it up, you may get notified by email. But again, it may be something that you need to respond to me. So the way you find that is we go back to that chart. On your chart, it's going to be red. All you have to do is click on View Flags. It'll bring up the comment. It'll tell you who flagged it, what page. Just take a look at it and respond to it by email or by doing something in the chart. So if you have any more questions, feel free to let me know. But again, case sensitive for password and username. We'll be keeping track of your procedures and the type of patients that you're seeing here. So again, let me know if you're having any problems. It's really a pretty basic setup. And I will see you guys on Thursday.